The title of this presentation is Surgical versus Conservative Care of ACL Injuries by Daryl Thompson and
Jacob Manley.
The objective of this presentation is to review ACL anatomy, discuss conservative and surgical treatments for ACL injury, weigh the benefits and disadvantages of each type, and discuss long-term outcomes of conservative care. As we learned in the summer courses that we took, the ACL is intracapsular but extrasynovial. It runs posterior lateral to anterior medial, and there's three different bundles: the anterior medial, posterior lateral, and the intermediate, which doesn't get much focus. It prevents anterior tibial translation, and it also restrains the varus, valgus, and internal rotation forces. For the ACL, all three bundles are taut in tibial and femoral internal rotation and closed chain movements. The anterior medial bundle is smaller and is tight throughout flexion. The posterior lateral is larger and tight in extension, and the posterior lateral provides more rotary stability. Now, within surgical treatment, there's many different types of surgical treatments that you can get. Many doctors argue over which grafts are better, whether it be hamstring or patellar tendon grafts. Autografts or allografts. Autografts is when you're taking a hamstring graft or a patellar graft from your own body, and allograft is when you're taking it from a cadaver. For the grafts, you can do a single bundle or a double bundle, and research has found that there's not much difference down the road on the stability for each of those. And surgical treatment, there's more risk for arthrofibrosis or graft failure, which pretty much means that scar tissue could build up inside the joint, which is not a good thing for a patient. For the double bundles, there's more of a risk for fracture because you're drilling more holes into the bone, which then weakens its integrity. And surgical treatment is also associated with increased levels of OA.
This is one of the articles that we looked at when we were researching this project, and this is a recent one from the Journal of Orthopedic Sport and Physical Therapy, and it talks about a lot of the risk factors for needing ACL reconstruction. And based on the systematic review that they did, there's a lot of good and bad reports on ACL reconstruction, and there's a lot of conflicting evidence on risk factors themselves. Some of the ones that we'll present to you later in the presentation are just kind of the consensus risk factors and indications for surgery that people have had for a long time. Another interesting fact that they pulled in this one is that one thing that is kind of predictive for the need for ACL reconstruction surgery is the shape of the lateral femoral condyle. And they found that the larger it is and the more spherical it is, that oftentimes that can be more indicative of a need for an actual ACL reconstruction surgery.
Indications for a surgical treatment. So if you have an athlete that is very active, let's say they're college athlete and their activity level is very high and they still have many years left, so that would be an indication for surgical treatment. If you're trying to reduce side-to-side laxity, especially with a rotary force or anyone trying to run, cut, college athlete in football, they're probably going to need a surgical treatment as well. If they have repeated episodes of their knee giving way, this would also be indication. And if an injury, let's say, has the unhappy triad while their MCL and their meniscus goes out while they're in there and already doing surgery, it would just be best to go ahead and repair that ACL while they're in there.
This is another article from JOSPT on ACL rehab, and this is this is actually a protocol for post-surgical rehab and then return to sport. But when we were looking through a lot of the protocols out there, conservative treatment is pretty similar to ACL reconstruction. Obviously, you're not going to do some things like wean someone off of a brace, but a lot of things are similar as far as the exercises go. And then as far as using modalities to control swelling and get back your quad strength and prevent inhibition. And then this slide right here shows you the actual ACL reconstruction rehab protocol that you guys can use for your reference. And then there's also a return sport criteria that the PTs in this article use for return sport with their athletes.
Now, within the conservative treatment, the main goals of the treatment is to reduce the swelling that's going to be located in the knee, restore quad function. Usually the VMO and the other quads can't fire as well as they once did. And you're trying to return the player or the patient back to the prior level of function. So therapeutic exercises that we've all learned over the summer, we're going to be trying to do all the quad strengthening, and hamstring strengthening is the most important of the strengthening groups during a conservative treatment. So without your ACL, you don't have, since you don't have your ACL, the anterior translation of your tibia is only going to be stopped by your hamstrings. So hamstring strength is very important. It was also saw that therapeutic exercises like non-weight bearing exercises, so swimming and cycling, they're also a very good idea for conservative treatment.
So copers are a group of ACL deficient people that can go through conservative treatment, or they can just kind of function on their own. And one such example is Hines Ward, formerly of the Pittsburgh Steelers. He actually has been ACL deficient since he was a child, and he ended up becoming a Super Bowl winning wide receiver. So there are people out there, and I know that every once in a while they pop up in your AT clinic. I think we had one this year with SU football that even though they have a complete ACL tear, it doesn't bother them at all.
Some of the indications for a conservative treatment, if you have a patient that's over 40 years of age, they can live, their quality of life isn't going to go down just from conservative treatment compared to a surgical treatment. Patients with low activity levels, if you're not going to have a patient that's going to be running and cutting and having a bunch of rotary forces put on it, then conservative treatment could be a best option. Non-compliant patients and people who have advanced arthritis, so if they have arthritis and the joint is already bad as it is, you don't want to open up their capsule and then have them rehab that and make things worse.
So this is another article that we came across when we were researching this project, and this one's interesting because it was a mail-in questionnaire for orthopedic surgeons, and they presented them with little scenarios. In this one that you see on the slide is a 46-year-old male soccer player who has an ACL lesion, and they went through and they used chi-square testing to see if there was agreement between the orthopedic surgeons and like what they would do clinically. And so here you can see that they ask them for the patient in this scenario, would it be better to do surgical or conservative treatment? And the majority of them chose conservative treatment because even though the individual in question is an athlete, he's also over 40. And surgical results are kind of back and forth as to whether they're superior or not. And actually, some of the more recent evidence shows that there isn't a lot of support to say that surgery is the best way to go anymore. And there's just another picture from that same article. And Mike and Katie's group, I believe, will be talking to you more about the different types of surgical treatments that you can undergo, whether it's an autograft or an allograft. But this is again showing you that of the orthopedic surgeons that were questioned, it looks like the hamstrings semitendinosus graft from yourself, so an auto hamstring graft, was more preferred by orthopedic surgeons than if you were to do an allograft. And these next two articles that you'll see, one's a systematic review, one's from the Journal of Athletic Training. It's an EBP article. And both of them talk about the prognosis of conservative ACL injury treatment. And it actually looks like ACL conservative treatment isn't as bad as probably what a lot of people think. I feel like the thing that everyone associates with an ACL tear is that you have to get surgery. But actually, a lot of the research that's out there says that they have pretty similar outcomes when you look at them down the road. And here's just that outcome paper from the Journal of Athletic Training. And Daryl's gonna get on in a second and talk to you about what they found.
In the research articles that we found, some of the findings were that good short-term and mid-term outcomes were reported with knee scoring scales and hop distance testing for both of these. But the only downside through some of the research that we found was that there was an associated decrease in activity level with patients that got the conservative treatment. There was a 21% reported rate of decreased activity level for the patients with conservative treatment. The 5-year outcomes show that there is no definite evidence that surgery provides superior results compared to that of conservative treatment. Patients who received surgery or conservative treatment had equal levels of pain, general physical health, and general mental health, and presence of radiographic OA.
And just a little nugget of knowledge for you, just because a radiograph shows something, it doesn't necessarily mean that the patient is symptomatic or complaining of it. So I'm sure that we'll learn a lot more about radiology and clin med and some of the other courses that we'll get throughout our time here at SU. But don't always go with what the radiograph says. Go make sure that you're always treating the patient. And these are the references that we use for our research. Thanks for watching, guys. See you at the workshop.